You've heard the name everywhere, Ozempic, on the news, on social media, from celebrities, maybe even from someone in your own family. People are calling it a miracle drug. Others are calling it dangerous. Some say it's cheating at weight loss. So today, as your doctor, I'm going to cut through all the noise and give you the real, evidence-based facts. By the end of this video, you'll know exactly what these medications are, how they work, who should and shouldn't use them, what side effect to watch for, and most importantly, why they work best only when combined with a healthy lifestyle. Let's get into it. So what exactly are GLP-1 receptor agonists? Let's start with the basics, and I promise, no medical school jargon. GLP-1 stands for glucagon-like peptide 1. That's actually a hormone your own body already makes naturally in your gut every time you eat. Its job is to tell your pancreas to release insulin, tell your liver to calm down on producing glucose, and most importantly for this conversation, tell your brain that you're full. GLP-1 receptor agonists are medications that mimic and amplify this natural hormone signal. The most well-known ones right now are semaglutide, sold as Ozempic for diabetes, and Wegovy for weight loss. It is given as weekly injections. Liraglutide, sold as Victoza for diabetes, and Saxenda for weight loss. This is given as daily injection. Tirzepatide, sold as Mounjaro for diabetes, and Zepbound for weight loss. It targets both GLP-1 and GP hormones, even more potent. Oral semaglutide, Rybelsus, a pill form taken daily for type 2 diabetes. Originally, these drugs were developed purely for type 2 diabetes. But during clinical trials, doctors noticed something remarkable. Patients were losing significant weight. That's when the research expanded and the world started paying attention. Let me walk you through exactly what happens in your body when you take one of these medications. There are really 4 key mechanisms. 1. Appetite suppression. GLP-1 acts on receptors in your brain, specifically the hypothalamus, which is your hunger control center. It reduces your appetite and makes you feel full faster and for longer. Many patients describe simply not thinking about food the way they used to. 2. Slowed gastric emptying. The medication slows down how quickly food moves from your stomach to your intestines. This means meals feel more satisfying, blood sugar spikes after eating are blunted, and you naturally eat smaller portions. 3. Improved insulin response. GLP-1 stimulates insulin release, but crucially, only when your blood sugar is actually elevated. This is different from older diabetes drugs, and is why the risk of dangerous low blood sugar episodes is much lower. 4. Reduced liver glucose output. It also signals the liver to reduce how much glucose it dumps into the bloodstream, which helps keep blood sugar levels stable throughout the day. The net result? Lower blood sugar, reduced appetite, weight loss, and in the case of semaglutide, clinical trials have shown remarkable benefits for the heart and kidneys too. We'll come back to that. This is probably the most important section of this video. These are prescription medications. They're not for everyone, and the decision should always be made with your doctor. So let me be clear about who they're actually designed for. Who may benefit? Adults with type 2 diabetes where lifestyle changes and metformin haven't achieved good blood sugar control. Adults with obesity or overweight with at least one weight-related health condition like high blood pressure, high cholesterol, or sleep apnea. People with established cardiovascular disease or high cardiovascular risk, where semaglutide has demonstrated evidence of reducing heart attack and stroke risk. Patients with chronic kidney disease and type 2 diabetes. New evidence shows significant kidney protective benefits. Who should not use them? People with a personal or family history of medullary thyroid cancer or a rare genetic condition called MEN2 syndrome. People with a history of pancreatitis. Your doctor needs to assess this carefully. Those who are pregnant or breastfeeding. These medications are not approved in pregnancy. Children and adolescents under 18, unless under specialist supervision. People with type 1 diabetes without careful specialist oversight. And I want to say this loudly and clearly. These medications are not cosmetic tools for people who want to lose a few vanity pounds. They carry real risks. They require monitoring, and they are meant for people with genuine medical need. If you're considering them, please talk to your doctor first. Now let's talk side effects, because I know this is what many of you really want to know about. I'll split this into common ones and serious ones. Common side effects, usually mild and temporary. Nausea, the most reported side effect, especially when starting or increasing the dose, usually improves within 4 to 8 weeks. Vomiting and diarrhea, more common early on. Staying well hydrated is essential. Constipation, particularly with semaglutide, increasing fiber and fluids helps. Fatigue or dizziness can occur as your body adjusts. Injection site reactions, mild redness or irritation where the injection is given. Most of these improve significantly once the body adjusts to the medication, and doctors typically start at a very low dose and increase gradually, specifically to minimize these effects. Serious side effects, rare but important. Pancreatitis, inflammation of the pancreas. Warning signs, severe abdominal pain radiating to the back, nausea, vomiting. Stop the medication and seek care immediately. Gallbladder problems, gallstones, or gallbladder inflammation, particularly with rapid weight loss. Kidney issues, dehydration from vomiting or diarrhea can strain kidneys, especially in people with pre-existing kidney conditions. Thyroid C-cell tumors, seen in rodent studies. Clinical risk in humans is uncertain, but the medications are contraindicated in those with the thyroid cancer history I mentioned. Ozempic face, rapid fat loss from the face, giving a gaunt appearance. This is a cosmetic concern, not a medical danger, but worth knowing about. Muscle loss. If weight loss is very rapid without adequate protein intake and resistance exercise, muscle mass can decline. This is why lifestyle matters enormously. If you experience anything that concerns you while on these medications, contact your healthcare provider immediately and never adjust your own dose without medical guidance. Here's where I want to spend some extra time, because this is the piece that gets left out of almost every Ozempic conversation on social media. These medications are powerful, but they're not magic, and the science is unambiguous. People who combine GLP-1 medications with healthy eating and regular physical activity have dramatically better outcomes than those who rely on the drug alone. Think of it this way. The medication lowers the volume of your appetite. It's your job to fill that space with the right things. And here's how to do that. Nutrition on GLP-1 medications. Prioritize protein at every meal. Aim for 1.2 to 1.6 grams of protein per kilogram of body weight daily. Protein preserves muscle mass during weight loss and keeps you fuller for longer. Think eggs, chicken, fish, lentils, Greek yogurt. Fill half your plate with non-starchy vegetables, broccoli, spinach, peppers, zucchini. These are high in fiber, which slows digestion further and feeds your gut microbiome. Choose complex carbohydrates over refined ones. Brown rice over white, sweet potato over chips, whole oats over instant oats. This prevents blood sugar spikes even more effectively. Eat slowly and mindfully, because the medication slows gastric emptying. Eating too fast or too much can cause significant nausea and discomfort. Small, frequent meals work better for many patients. Stay hydrated. Dehydration worsens nausea and constipation, both common side effects. Aim for at least 2 liters of water daily. Limit ultra-processed foods, alcohol, and high-fat fast foods. These can worsen nausea and counteract the metabolic benefits of the medication. Exercise and physical activity. Resistance training is non-negotiable. Lifting weights or doing body weight exercises 2 to 3 times a week helps preserve muscle mass, which is critical during weight loss on these medications. Aim for 150 minutes of moderate aerobic activity per week, brisk walking, cycling, swimming. This improves insulin sensitivity and cardiovascular health beyond what the medication alone achieves. Even light, daily movement matters. A 20-minute walk after dinner can significantly blunt post-meal blood sugar rises. The clinical trials for semaglutide that showed the most impressive results, up to 15 to 20% body weight reduction, were all done alongside lifestyle counseling. The medication and lifestyle aren't alternatives. They're partners. One without the other is a missed opportunity. Before I wrap up, let me quickly answer the questions I get most often about these medications. Will I regain weight when I stop? Honestly, yes, in many cases. These medications work while you're taking them. When you stop, hunger often returns to baseline, and without lifestyle changes firmly in place, weight can return. This is why building sustainable habits while on the medication is so important. The drug is a tool, not the solution. Is Ozempic safe long-term? We have reassuring data going out to several years now. For people with type 2 diabetes, long-term use is well studied and generally considered safe under medical supervision. Long-term data for weight loss specifically is still accumulating, which is another reason regular check-ins with your doctor are essential. Can I get it just to lose a little weight? Please don't try to access these medications outside the proper medical system. There are shortages affecting people who genuinely need them for diabetes management. And taking a prescription medication without proper evaluation and monitoring is always a risk. What about cost and access? Cost is a real barrier for many people. Talk to your doctor about whether you qualify, what's covered by your insurance, and whether there are patient assistance programs in your region. So let me leave you with this. GLP-1 medications like Ozempic and Wegovy are genuinely impressive medical tools. For the right person, used properly, combined with healthy food habits and regular movement, they can be life-changing, not just for weight, but for long-term heart health, blood sugar, and quality of life. But they're not a shortcut. They're not for everyone. And they're not a replacement for the fundamentals of health that I talk about on this channel. If you found this video helpful, please hit that like button. It genuinely helps other people find this information. Subscribe if you want clear, honest medical content every week. And drop your questions in the comments below. I read every single one, and your questions shape my future videos. Take care of yourselves. I'll see you in the next one.